The current recommendation for colon cancer screening for an individual without a family history of colon cancer is the age of 45. For an individual with a family history of colorectal cancer and their dad, mom, brother, or sister is the age of 40 or 10 years prior to the diagnosis of that relative. I'm Jesse Gray with Salina Regional Surgical Associates.
Dr. Gray, thank you so much for coming on the show. We're going to be talking about colon health, in particular colonoscopies. I think it's important to start, what are the recommendations for someone to have a colonoscopy?
Thanks for having me. The current recommendation has changed. It used to be 50 years of age and now it's changed to the age of 45.
Okay, so let's talk about the process of when somebody comes in to have a colonoscopy. What do you tell the patients?
Great. So I tell my patients that while they're asleep, I'm going to pass a lighted endoscope through their colon and I'm going to slowly retract it. I'm looking for the big bad boogeyman under the bed, colon cancer. That's why we do these screenings, right? If I see anything that looks like it, I take biopsies. But most of the time what I find in folks is just polyps. Polyps are like moles on your skin but on the lining of your colon. We get rid of polyps because we know that most colon cancers start out as polyps. And by getting rid of a polyp, we can hopefully prevent you from having colorectal cancer. Anytime I take a biopsy, anytime I pass a scope, and anytime I take a polyp, there's a less than a 1% chance of bleeding or infection. Less than 1 in 2,500 chance of injury to your colon.
I know people are reluctant to have a colonoscopy. It's not necessarily the most exciting thing to think about doing, but it is very successful, right?
Yes, I think it's incredibly important for your colon health. It's the one test that we can actually be both diagnostic and therapeutic. There's other tests out there for colon cancer screening that are not as effective and not considered the gold standard like colonoscopy.
Well, you gave our times when we should go and have a colonoscopy. Are there some areas that fall outside of that maybe have some special circumstances?
Yes, people who have a family history and their dad, mom, brother, or sister of colorectal cancer should have a colon cancer screening at the age of 40 or 10 years prior to that relative's diagnosis, whichever sooner.
Okay, and if something's found on the biopsy, obviously they maybe have to have them more often, is that correct?
Absolutely. Anybody that comes in for a screening for colon cancer and is found to have polyps or other abnormalities may have to have a sooner interval for screening, such as 5 years or 3. Colonoscopies allow us to also find other abnormalities in your colon health, such as diverticulosis. People who have diverticulosis should be increasing their fiber intake and watch out for abnormal abdominal pain.
It's also important to talk a little bit about colon health and what you talk to your patients about.
Colon health is incredibly important and often very neglected. Two of the most important things that a patient can do to increase their colon health is to increase their hydration as well as to increase their fiber intake.
Very good. Thank you so much for some great information, and thank you for watching. For more information, please visit the Surgical Services tab of srhc.com, like us on Facebook, follow us on Twitter and Instagram.